Verbal versus nonverbal communication in nursing. Communication is at the heart of nursing. Every interaction with patients, families, and colleagues sends a message. Some of those messages are spoken, and many are not. Communication is like a beautiful cake. It has layers. The words we use form one layer, but the meaning is shaped by the layers and decorations around it. Verbal communication carries the message, while nonverbal communication shapes how that message is received. Separate in theory, but inseparable in practice, they combine to determine what people truly hear and feel. Verbal communication uses language to convey meaning. This includes spoken words, written communication, and formal sign systems. In nursing, verbal communication is essential for sharing clinical information, instructions, and documentation. Verbal communication is structured. It follows rules of grammar and vocabulary, and it's especially useful for conveying facts, timelines, and complex information. Let's break down the different forms of verbal communication with some examples in nursing. Firstly, spoken words or oral communication. This includes bedside conversations, team briefings, phone calls, explaining a procedure to a patient or family member, giving a patient discharge instructions, and handing over care during shift change. The second form of verbal communication is writing. Nurses do a lot of that. In a hospital environment, this will usually be in the form of updating patient charts, completing reports like IPC, incident and monthly reporting. Writing also includes emails, policies and procedures, and discharge booklets for patients. Thirdly, we have sign language, communicating with patients who are deaf or hard of hearing. Note how sign language follows the criteria for verbal communication. It is structured, follows rules, and can be used to convey complex messages. While verbal communication is powerful, it never happens in isolation. Every spoken message is accompanied by nonverbal signals. Nonverbal communication refers to how messages are conveyed without words. This includes body language, facial expressions, space, touch, tone of voice, time, and even the environment. Nonverbal communication is more informal and relies heavily on context like culture, environment, relationships, and the specific situation. It happens naturally and automatically. In healthcare, nonverbal communication often communicates things like empathy, confidence, anxiety, respect, and urgency. Patients may forget what we say, but they often remember how we made them feel. There are various categories or layers of nonverbal communication. We will be looking at some next. Remember that many of these actions happen in conjunction with verbal communication. It can get rather complicated.
No. Yeah. I don't know what I'm supposed to say right now.
Let's get into it. Firstly, we have kinesics or body language. This includes posture, gestures, eye contact, and facial expression. Examples of this are smiling and nodding while listening to a patient, crossing arms during a difficult conversation, avoiding eye contact when feeling rushed. A nurse may say, "I'm listening," but their body language will tell the patient whether that's true. Proxemics refers to how we use physical distance in communication. If you own pets or have kids, you know how they like to stand close to you when communicating. In a professional setting like nursing, being aware of the space between you and your intended audience can help you adjust. This ensures your message is received as intended or enhance the message. It may include things like sitting at eye level with a patient instead of standing over them, maintaining a respectful distance during sensitive conversations, stepping closer when a patient is anxious, or stepping back when they appear uncomfortable is use of physical distance during communication. Appropriate use of space supports dignity and trust. Thirdly, we have haptics. Haptics is communication through touch. Touch is a powerful communicator and can communicate comfort and compassion, but must always be culturally sensitive and appropriate. Examples in nursing includes a gentle hand on the shoulder for reassurance, holding a patient's hand during a painful procedure, and a firm professional handshake with colleagues are all examples of how touch plays into communication. Paralanguage refers to how something is said, not the words themselves. It refers to vocal qualities like tone, pitch, volume, and pace that accompany speech. They are considered nonverbal because they influence meaning without changing the words themselves. The tone, volume, or pitch can change the meaning of a message completely. Saying "you're fine" in a calm, reassuring tone versus a rushed or irritated one conveys two completely different messages. Next, we have chronemics. Chronemics is about how we use time in communication. In nursing, time sends a message. When we're punctual for meds, patients feel secure. When we pause after delivering difficult news, we show we understand that it takes a moment to process. When we rush through explanations, even unintentionally, it can feel dismissive. Being aware of how we manage our time, especially under pressure, helps us protect the quality of care and the patient experience. Sometimes giving someone just a few extra seconds can make them feel truly valued, and that can change the entire experience. The sixth layer is appearance, objects, and the environment. They also send messages. The professional attire and name badges nurses wear builds trust and confidence in a professional service. Curtains drawn for privacy during care conveys a message of being seen, protected, and respected. In contrast, a cluttered nurse's station suggests busyness or disorganization. The environment can either support or undermine communication. Picture charts also falls under this category of nonverbal communication and is critical in a healthcare setting to convey important information, especially across language barriers. Verbal and nonverbal communication always work together, but because nonverbal communication is so powerful, it holds the trump card. When verbal and nonverbal messages conflict, people tend to believe the nonverbal message. Because communication does not happen in isolation, it is crucial for effective nursing communication to align what we say with how we say it. And in conclusion, every interaction communicates something. Let's make sure it's the message we intend. Thank you for joining us in discussing verbal versus nonverbal communication in nursing. From care leaders consulting to all nurses, keep learning and keep growing. Until next time.